Cori and Krysten. So osteogenesis is brittle bones, so like it means your bones break very often and they're very fragile. You can see that there's more holes in the bone over here, and the reason is the body doesn't make enough collagen, and this disease is oftentimes a genetic disorder. Symptoms include bone fractures, blue tinge of the white of the eye, bone tissue formation, bow legs, bruising, callus, large head, physical deformity, scoliosis, short stature, and stiffness. So this is an adult with osteogenesis, and that's oftentimes how they end up looking. So assessments, really, the doctor will just ask for your family history, you'll get x-rays, and you'll have DNA sampling, but oftentimes it's hard to tell if you have osteogenesis or not in the beginning. So mutations in several genes leads to osteogenesis. It is caused by defects related to a protein called type 1 collagen. Collagen is an essential building block of the body that makes bones strong, and it builds tendons, ligaments, teeth, and whites of the eyes. Very important. So the diagnosis right here, you can see the blue tinge of the eye, which is one of the symptoms. The diagnosis of OI is made on the basis of family history and clinical presentation. Obviously, frequent fractures, short stature, teeth problems, hearing loss, and also there's some mental effects that can happen as well. So there's no cure. You just kind of live with the symptoms and try to manage symptoms. There are surgical procedures such as rodding, which a metal rod is placed through the long bones, and they can also do this with the spine. So you most likely will be in a wheelchair, you'll be in a brace, anything else like that. There are some medications you can take to strengthen your bones, and one thing that is highly recommended would probably be to drink milk, because there's a lot of vitamin D and calcium in milk, and it strengthens your bones, as well as the two other medications, but these are not cures, they're just cures for symptoms. Most people with OI lead successful lives but are limited in participation of physical activities and other things. They are more likely to fracture or break bones doing daily activities, so like simple activities just such as brushing their hair or bumping their elbow, they could break their bones. Respiratory failure following an accident, so like breaking a rib or something, would most likely puncture the lung, which leads to respiratory failure, and that's often the cause of death in people with OI.